Okay, how are you today?
I'm doing okay. My voice is just a little raspy, and I don't know why, so that's why I came in today.
Okay, I'm just going to ask you a few questions. When did your speech problem first start?
Well, I went to the hospital about 2 weeks ago with my husband, and that's when it first started.
Okay. And did it come on suddenly or over a period of time?
Well, one Sunday morning I was getting up to get ready for church, and I noticed something was wrong with my voice because I kept having to repeat myself to my husband, and I tried to drink lots of water because I just thought maybe that was why my throat was dry.
Okay. And who first noticed the change in your speech?
My husband.
Okay. And did anything else change at the same time?
Well, to think about it, the right side of my face feels heavy, and my right arm feels weaker than normal.
Okay. And would you say your speech problem is getting worse, staying the same, or getting better?
I think the speech is getting a little better.
Okay. And is your speech better or worse at certain times of the day?
Not really certain times of the day, but I feel as it gets worse when I'm tired or when I feel stressed.
Okay. And does your face or mouth feel any different than before the problem started?
The right side of my face feels heavy, and I've noticed some drooling when I've been eating.
And so you say you've been having trouble with the drooling. Is there any other trouble with the eating?
Well, yeah. Sometimes I feel like my tongue is like thick. It's like I can't move my mouth, like my food around my mouth, and like I had a hard time swallowing and chewing at first, but it is getting a little better.
Okay. And do you have any trouble controlling your emotions?
No, I don't think so.
Okay. And what bothers you about your speech?
Just that people can't really understand me sometimes, and it's just frustrating when I'm trying to get my point across. They can't understand me.
Okay. When do you have the most trouble making yourself understood?
Probably when talking to strangers.
I can understand that. Do you avoid situations because of your speech?
Oh yeah, because I don't like to repeat myself, and it takes me a lot longer to say what I want to say.
Okay. Have you found anything that helps people understand you better?
Definitely when I just look right at the person, because I guess they can read my lips.
Okay. And who is helpful to you in dealing with the speech problems?
Just like always, like my husband, he's always there for me and trying to, clarify to people like what I said, because I feel like he knows best what I say.
Okay. And have you had any treatment for the problem?
No, I have not.
Are you taking any medications for the problem?
No.
Okay. Do you take any medications that make the problem worse?
Not that I'm aware of.
Okay. And what has the doctor said is the cause of the speech problem?
Dr. Payne, who is my primary care doctor, he said that it was probably because of my stroke that I had.
Okay. And what has the doctor said about, or what do you want to accomplish with therapy?
I just want others to be able to understand me. I want to live a normal life.
All right, that's completely understandable. And what questions do you have for me about the evaluation or your speech problem?
How long is it going to last?
Okay, yeah. Well, that is a good question, and we're going to, do this, and then we'll see where it takes us, okay? And then my last question for you today is, how has your speech problem affected interactions, like with your family, friends, or coworkers?
Well, overall, I just want them to understand me, but I feel like my family, they understand me better than like strangers or even coworkers. And but that's probably typical because you're around your family all the time. Like I said, my husband.
Okay. Okay. All right. So now we're gonna do. I'm gonna look at your face and your lips, the inside of your mouth. And is it okay if I touch your face?
Yes.
Okay. So the first thing I have, do you wear any kind of dentures?
No.
Okay. And now I'm going to look at your jaw. So can I have you just open and close your mouth like? Okay. And then now I'm going to have you say E, E. Okay. And then I just want you to close your lips and rest. Just your lips at rest. Okay. And then now I'm going to have you go ooh, ooh. Okay. And then I want you to smack your lips like. Okay. And then now I want you to stick your tongue out at me. And then retract it. Throw it back in your mouth. Okay. And then I'm going to have you lick your lips all the way around. Good job. And then now I'm going to have you stick your tongue in both sides of the cheek like this. Okay. And then now I'm going to have you take your tongue and go to both corners. Okay. And now I just want you to try to touch the tip of your nose and then the bottom of your chin with your tongue. Okay. And then now I'm going to have you go, oh, oh. And now can I have you go, ah, 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 ah. Okay. And now I'm going to stick this in your mouth and just to check for a little bit of a gag reflex, okay? Well, first I'm going to do something real quick. I'm going to stick this on your chin and I'm just going to tap it, okay? Okay. Now I want you to open your mouth and I'm just going to stick this in your mouth. Okay. And, okay. Okay, I'm going to have you count to 20 on one breath. So I will model it and then I'll have you do it, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay. 1, 2, 3, 4, 5. Okay, that's okay. Now I want you to take a good deep cough, like thank you. Okay, now I'm going to have you say, many men may mourn him. Many men may mourn him. Okay. And I'm going to have you say one more. Bobby's puppy was cute. Bobby's puppy was cute. Okay, and now I'm going to have you count 1 to 100. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. This is going to take a while. 18, 19, I'm getting kind of tired. Okay, that's okay.
So I just want you to read this passage.
Okay. You wish to know all about my grandfather. Well, he is nearly 93 years old, yet he still thinks as swiftly as ever. He dresses himself in an old black frock coat, usually several buttons missing. A long beard clings to his chin, giving those who observe him when he speaks, his voice is just a bit cracked and quivers a bit. Twice each day, he plays skillfully and with zest upon a small organ, except in the winter, when the snow or ice prevents. He slowly takes a short walk in the open air each day. We have often urged him to walk more and spoke less, but he always answers, "But Nana, grandfather likes to be modern in his language."
Good job. Well, I'm glad that you were able to come today, and I'm hoping that maybe we can look at all this stuff and gather our information and give you a little bit more information too about what we have found today. But I just want to ask you a few more questions, if that's okay. So, are you working right now, or are you retired?
I'm retired.
Okay. And then, what do you or what did you do for a living?
I was an elementary school teacher.
Oh,
Yeah,
nice.
here in Murray.
Okay, nice. So so you live here in Murray
Yes,
then?
I do.
Okay.
Yes.
And have you lived here all your life?
Well, I lived in Lexington. I went to UK for school and stuff.
Oh, awesome.
But I've been here for 30, 40 some odd years.
Oh, that's lovely. So what do you like to do in your spare time? Do you have any hobbies?
I love to garden. If the weather would ever change.
Yes.
I got my seeds and I'm ready to plant them.
Yes, I'm ready for some warm weather myself. Do you have any children?
No, I don't.
Okay, that's okay. And do you have any nieces or nephews?
Yeah, I do. I have one. I have a sister, so I have one little niece.
Oh, well, that's precious. How old is she?
She was adopted, so
Oh, okay.
she's 6.
Oh, nice. Well, you said you went to school at UK, right?
Yes.
Okay. So did you go there the whole time?
Yes, for my undergraduate and for my master's.
Okay. And then, so what's something that you like to watch on TV?
Well, I've always been a UK Wildcats fan, and my husband's a U of L fan, so
Oh, no.
we always watch UL and UK play basketball, softball, football, everything else.
Yeah,
Big sports fan.
I can only imagine. So I guess it gets pretty heated in your house during those
Yes.
games. Right. And also, I just got 2 more questions to ask. When did you, so like when you get out of the house, where do you like to go? Do you have any special place here in Murray that you like to go?
Arboretum's really pretty.
Yes.
I like to walk around there.
Mm-hmm.
It's a lot easier before I had all this and stroke and stuff.
Yeah, I can only imagine.
Yeah.
So what's your favorite restaurant here in town? Do you have a favorite restaurant?
Oh, well, my husband and I, we actually met at Martha's. So I came up to Murray, like after we moved from Lexington, and we met at the little Martha's restaurant down there on 641, and we always go there every Friday night.
Oh, well, that's
It's my
lovely.
favorite restaurant.
Well, I enjoyed having you today. Okay. So, after looking at our assessment today and also reading over the doctor's notes, it has came to our attention that you have had a stroke here recently. And with this stroke, there's a certain part in the brain, the left side of your brain, which is very important for your speech, speech output, anything like that. And the particular part that you had the stroke in was in that left part of your brain, in a place we call the internal capsule. And your internal capsule is very important for like those. It's real crucial for that fine coordinated, skilled movements. And so, whenever there's damage to this site, it can cause a disruption in your speech or cause like speech problems. Also, with this, you can see a lot of weakness within your right side of your body, because although the damage was in the left side of the brain, there's something that goes on where the nerves, they dissect, or not dissect, but they cross. And so because you had the stroke on the left side, you're seeing a lot of these symptoms in your right side. So that's why you're having the right-sided weakness, and then the jaw, weakness on the right side of your face, like the heavy feeling on the side of your face and the side of your tongue. And then Miss Rachel here will talk to you a little bit about why you're also seeing some of the other things you're seeing.
So like Liberty said, because it's the left hemisphere, you're going to be seeing a lot of like the weaknesses in your right side. So that's also with like the dysphagia you're having with the drooling when you eat. That's one of the characteristics of that left side being hit right there with the stroke. And so that also with the speech characteristics, that's with you have unilateral upper motor neuron dysarthria, and we'll go into more detail about that in a minute, specifically what that is. But that's why you're having the harshness in the voice. That's why your voice, you say, sounds really dry, and you feel like you just need to be drinking water. And that's also why you're slow. You have a slow rate. And when we were doing the AMRs, which was the pa, that's why the voice rate was so slow also. So based on everything that we've seen with your characteristics that you're presenting with, we have come to the conclusion that your diagnosis is a dysarthria, and there are different types of dysarthria. Liberty would tell you exactly which one you have and kind of explain that in a minute. But dysarthria as a whole is just the difficult articulation of speech, which is caused by that muscle weakness, which is caused by usually like the stroke is what your kind of dysarthria is caused from. But do you want to go into more detail about?
So we have came to the diagnosis of a unilateral upper motor neuron dysarthria, and since you have that unilateral, that one-sided stroke, that is why you're seeing a lot of motor signs within that right side. And like she explained earlier about the different type of speech characteristics you're having and stuff, those are apparent and they're expected with this type of dysarthria. So this is normal with everything that's going on with the side of the stroke that you had it and where the lesion is inside the brain. Okay, so you had mentioned earlier that you feel like your speech has gotten a little bit better since you first noticed it. I do want to let you know that is something you will see with unilateral upper motor neuron dysarthria, because this type of dysarthria is seen to kind of spontaneously recover, but we will still do therapy with you to kind of help you learn to gain those motor controls back of your speech. And but yes, I want you to know that it is spontaneous, and sometimes you will see, that spontaneous recovery. But if you do see any type of regression within your speech, please don't hesitate to tell me or your doctor as soon as possible.
So today we evaluated a 53-year-old female patient. According to the doctor's notes, she recently had an infarct in the posterior limb of the left internal capsule. The left internal capsule is in the vicinity of the basal ganglia and thalamus, which is innervated by the upper motor neuron direct activation pathway. She was referred to us by the doctor due to concerns regarding her speech. Upon evaluation, it was noted that the patient had facial drooping in the right corner of her mouth, a harsh voice, and slow rate. Drooling was also observed during the assessment. The lesion in the posterior limb of the left internal capsule led to unilateral upper motor neuron dysarthria, which usually produces a constellation of physical signs and symptoms on the side of the body contralateral to the lesion. This is the reason why the patient is showing signs and symptoms on the right side of her body rather than the left side. Unilateral central facial weakness as well as unilateral lingual weakness was present in this patient. Deviant speech characteristics were observed during the oral mechanism examination. So we looked at the lingual function, was observed to determine the patient's strength, range of motion, and rate, and coordination of the tongue. It was observed that the patient had right-sided weakness of the tongue. We also looked at velopharyngeal closure to determine if the patient had sufficient closure of the velum. And the velum closure we determined it was within normal limits. The gag reflex was also observed to determine sensation around the area of the velopharyngeal area, and the patient had a proper gag reflex. Observation of the movements of the jaw, tongue, and face determined the right-sided weakness or the drooping and weakness of the right side. The alternating motion rates, the AMRs, and the sequential motion rates, SMRs, were observed to determine the patient's ability to change position of the articulators. So the results of the AMR and the SMR determined a slow rate and imprecise articulation for this particular patient. The cognitive or communication evaluation determined the patient was cognitively appropriate to complete this assessment. And then I'm going to have Rachel here talk about the other part of the assessment.
So we looked at the physiological systems of respiration, articulation, phonation, resonance, and prosody. Those were all observed. So to assess the respiration, the patient was asked to count from 1 to 20 on one breath. The patient was not able to complete the task in one breath. Decreased respiratory drive due to fatigue was noted, and the speech was noted that the speech worsens with fatigue. The patient presented with articulation deficits with mild to moderate ranges in severity, imprecise consonants, mild irregular articulatory breakdowns, and reduced AMRs, as Liberty mentioned earlier. And to assess phonation, the patient was asked to take a strong cough. The patient presented with a mild, harsh vocal quality, but this may indicate laryngeal involvement. And then to assess the resonance, the patient was asked to repeat a sentence with many nasal sounds. So she was asked to repeat, "Many men may mourn him," and then a sentence with no nasal sounds, which was, "Bob's puppy was cute." And these sentences sounded distinctly different, which is normal, so nose resonance issues were noted. To assess prosody, the patient was asked to count from 1 to 100 in order to determine an exacerbation of symptoms as an effect of fatigue. The patient was unable to count all the way to 100 due to fatigue. The patient's rate became slower the longer she counted, and prosody difficulty is often due to slow rate of speech. The patient was asked to read the grandfather passage. The patient was able to read the whole passage, but read it at a slow rate and presented with imprecise articulation. Questions were also asked at the end of the assessment to elicit conversational speech, and the patient was able to understand and answer all the questions asked to her. While answering the questions, the patient had slow rate of speech as well as a harsh voice and some imprecise articulation. The patient answered all the questions in short sentences also.
So overall, we just kind of determined that because of all of her signs and symptoms that this particular patient did have, that she does have a unilateral upper motor neuron dysarthria due to the lesion in the left hemisphere of her brain in the internal capsule, which is innervated by the direct activation pathway. And with the direct activation pathway, since it happened in the left side, you're seeing all the contralateral damage it's contralateral to the right side.
Yeah.
Yeah. Okay.